Hello, Dr. Matthew Rogolski. I'm the Medical Director for the Wound Institute of Ocean County here in Toms River and Senior Partner at Ocean County Foot and Ankle Surgical Associates. Please call me Dr. Matt. Have a seat. Let's talk about what we mean when we say neuropathy. In the diabetic population, you get a lot of neuropathy. That means a simple nerve dysfunction. The nerves are not working to send pain signals, things of that nature, to the brain. And the reason why that happens is because when you have high sugar, the insulating layer of your nerve starts to disappear. And so the electrical signals can leak out of the nerve without making it all the way to your brain for interpretation. Neuropathy, again, nerve dysfunctions, hard to feel, pain problems, temperature problems, things of that nature. That's what we mean by problems with your sensation. Hard to interpret, things that hurt you, things that could burn you. When you twist your ankle or something, you drop something on your foot, it's hard for you to feel those problems. That's sensation. The second part is something called motor neuropathy. Have you ever wondered as a diabetic, why do you feel tight and stiff? Why do you get a lot of hammer toes, bunion problems, Achilles problems? That's because when you're diagnosed with diabetes, at the day of your diagnosis, you've lost 50% of the muscle mass in your feet. That means it exposes a lot of these bony prominences to high pressures. And when you get high pressures, you get a callus. And a callus in a diabetic who has nerve problems is a great risk for foot ulceration, up to 11 times greater than the non-diabetic. So that's why you get a lot of these clogged toes, you get these problems with your feet because of atrophy of your muscle tissue, because it's not being stimulated by your nerves to act appropriately. The third part is what we call the autonomic or the automatic nervous system. And that encompasses a couple parts. One is stimulating your sweat glands to make enough skin oil. And where do you have a lot of your sweat glands? In your feet. Have you ever noticed as a diabetic, your feet get very dry, as well as a lot of the skin on your body feels very dry. But in your feet, they get dry, scaly, and when you don't stimulate those sweat glands to make enough skin oil, your skin gets dry and then it can crack because there's so much pressure and tension on your feet. The skin is being pulled, no elastic recoil. And those fissures can lead to full thickness ulcerations, what we call when you can get deeper structures exposed, and infection. That is why when you have those types of problems, you need to see us right away so we can treat that. Also with the automatic nervous system, it's difficulty controlling heart rate and rhythm. So that's another reason why you need to have a cardiologist. All diabetics need to have a cardiologist. Even if you feel great, fantastic that you're seeing at least once or twice a year so that can be checked and monitored. We here at Ocean County Foot and Ankle are experts in the diagnosis and the treatment of peripheral neuropathy. Yes, diabetes is a leading cause of that, but also alcoholism, chemotherapy, certain radiation, autoimmune diseases can cause those problems, like rheumatoid arthritis can cause neuropathy, and sometimes we don't know why it happens. Certainly back problems, spinal derangements, spinal stenosis, slip disc, those as well can cause that. So you need to come and see us so we can help you in that diagnosis. And in the second part of this video, we will talk about treatments for that. So please join us for the second part in treatment of diabetic neuropathy.